Good morning, everyone, and welcome, and thanks for those who have joined us today. We've got a pretty good group on Zoom and on some other media. And the reason we're here today and the reason that we call this special meeting is our community is slipping into a more dangerous and critical time with the COVID virus. Red Banks is having a serious problem, and we all know that, but I'm here to tell you, and the numbers show it, that's not our only problem in Henderson. We need our business leaders and citizens to step up right now. We're not looking to shut things down. That's not what we're all about. But we are a red county, one of 18 in the state of Kentucky, and the state is looking at these red counties to see what the future might have for them. We've got to use October to improve our position, or I'm afraid we will be facing sanctions and some possible closings. As citizens, I ask you to do the right thing. You know what the right thing is. You've heard it 1,000 times in the last 6 months. As businesses, I ask that you protect your employees and the public, and you know what is required for that. I don't have to go through all those step-by-steps. You know what that is. I want to mention one other thing to you as well before we bring some of our guests up. I want you to make sure that you get a flu shot. There are several free opportunities and several opportunities where insurance, Medicare, Medicaid, and all of those things are cover those flu shots. One health issue is enough to deal with. We certainly don't need two major problems going on. So get your flu shot, and when the vaccine is ready, get your vaccine shot. I'm going to pass the discussion along right now to a friend and someone that's been very helpful to us, and that's Clayton Horton. And Clayton is the Public Health Director at the Green River Area Health Department, and he's going to share some information with you. So, Clayton.
Mayor, I appreciate you putting this together today and getting this all together to talk about this important topic. Again, I am Clay Horton with the Green River District Health Department, and we really appreciate the support we've gotten from Judge Executive Snyder and Mayor Austin. But we are at a critical point in our communities and really in our region. We've continued to see our cases of COVID-19 increase over the last couple of months, and we've really hit a tipping point. And so it's a signal to the entire community that we need to sit up, take notice, and follow the advice of experts. I keep saying this over and over the last few days as I've had these conversations with individuals, but we know what to do, and it's rather simple. It's just difficult to make ourselves do it. But we need to limit our interactions. We need to wear masks when we're around other individuals. We need to wash our hands frequently, and we need to watch our distance. And so our challenge is we all have to take those 3 W's, wear a mask, watch your distance, and wash your hands, and apply those to our individual lives. So when you're making decisions about how you're going to spend your time, who you're going to get together with friends, figure out how to do that safely and apply that to your lives and answer that challenge. It really does make an impact. The mayor mentioned we've seen some large outbreaks in long-term care facilities in our region, and those don't happen by accident. When we have this level of spread in the community, we're at high risk for that happening, and that's how the infection gets into long-term care facilities. That's how it gets into nursing homes, and that's where we have a vulnerable population and we have high risk of people dying. And so the decisions we make in our individual lives, what we're going to do this weekend, has an impact on the entire community and has an impact on other people and their loved ones. So with that, again, the 3 W's, watch your distance, wear a mask, and wash your hands. And Mayor had asked me to make some suggestions to folks about what to do when you're in the community and you see people not wearing masks. obviously, at the health department, we have a role in going out and educating and enforcing that. We're happy to continue to do that. So you can report that to us. You can report it to Kentucky Safer Hotline. But more importantly, we have to police this by consensus. As a community, we have to come together, and everybody has to step up and take a leadership position. So if you're a business owner, make sure that your customers are wearing masks. If you're in charge of a Little League organization or a group with your church, make sure that as you interact with those individuals, that everybody's doing the right thing. Stand up, speak up, and take some responsibility for that. If you're into business and you see that people aren't following the rules, enforce that with your dollars. Don't patronize businesses that aren't making folks social distance and wear masks. So it's really not the city's place, not the county fiscal court's place. Obviously, the health department, we all have a role in this, but the community as a whole has to take ownership of this. And if we do these things, we know it'll have an impact. And we know that we will see the results in the spread that we're seeing in our community. So I'll be here to answer any questions you have, Mayor, and appreciate again the support you've given us. And we're always here at the health department to help and support any way we can.
Thank you, Clayton, and our health department does a great job. You know, we have, I think on Wednesdays mornings, they have the COVID testing, and I do that about once a month just because I'm around so many people and out so much. It's not a painful thing. Some people think it's a painful thing, but it's not a painful thing. It's about 5 seconds of being slightly uncomfortable, and then you go right on about your business. They also are offering flu shots, and all of that information is on their website, and you can make your appointments for the COVID test and for the flu shots right there online on the Green River Health Department's website. County Judge Brad Snyder has joined us today through Zoom, and I wanted to give Judge Snyder an opportunity to speak as well. Judge, you're on.
Thank you, Mayor. I think that what I can add to this is merely an appeal to the people of Henderson County and the city of Henderson. If you care about this city, if you care about this county, if you care about your neighbors and your friends, and you care about the financial viability of Henderson County in the future, you need to wear a mask. You need to wash your hands, and you need to watch your social distance. It's that simple. This is not a political issue. COVID-19 is not part of some larger political conspiracy. It is not a test of your loyalty to one view of a constitution or another. It is a public health concern that is killing people in Henderson County right now. We've had several deaths just in the last week of people who otherwise might have lived longer lives. So if you understand that and you care about those people you don't know and people you do know, you need to wear a mask. Make it a personal responsibility. Take action yourself and help us drop this spike and try to get our lives back to normal as soon as possible. Thank you, Mayor.
Thank you, Judge. Appreciate it. Deaconess Henderson Hospital Administrator Linda White is with us today as well. And she is on the absolute, as Clayton is, she's on the absolute front line. And some of her comments and will be very helpful, and you need to make sure you listen carefully and take it to heart. Linda?
Thank you, Mayor, and thank you to the citizens of this community. We gathered in March, if you can remember back that far, to inform the public about a virus. And this was the virus that we labeled as the coronavirus or COVID-19. Now, 210,000 deaths later in the United States alone, we've seen some of the highest positive number of cases yet. And folks, this is 8 months into this pandemic. And we tried to prevent the spread of the disease, but 8 months later, we are still fighting the disease right here in our own community. As of yesterday, 1,229 people in Kentucky alone died of complications due to COVID-19. 1,229 lives have been lost in this Commonwealth. Folks, we're in the thick of a pandemic, and we cannot let our guard down. That's my message to you. We cannot let our guard down. Henderson, Webster, and Union counties are now in the red zone. And what that means is that the number of new positive cases continues to rise. And as of this morning, Friday morning, Daviess County has also been added to the red zone. This is not where we want to be. Red is at the highest level of concern, and here we are in the thick of it. We all recognize that there's genuine coronavirus fatigue, and that means we're just tired of this thing. 8 months in, we still haven't been able to socialize, we haven't been able to go to our weddings, we haven't had our parties, but we've got to be on our guard. We're tired of not socializing, we're tired of not having good internet connections, we're tired of having the children at home, we're tired of all of those kinds of things. We're tired of wearing masks. But guess what? We have to pull out our diligence. Not only is there coronavirus fatigue, but there is confusing information out there, let's face it. The CDC recommends one thing on a Friday and it is discounted on Monday. But I'm here to tell you today and reinforce what Clay has already told you. It's a very simple message. Wear a mask, keep social distancing, wash your hands, continually wash your hands. Let me share with you a few facts to drive home why this is still a pandemic. Last week at Deaconess Midtown and Deaconess Gateway Hospitals in Indiana, they had over 100 patients who tested positive. 100 patients, that's the highest number that Deaconess has recorded in this community. This week, and I counted this morning before I came over here, Deaconess has as many as 90 patients between Deaconess Gateway and Deaconess Midtown. And over a third of those are in the ICU. We still have plenty of ventilators. I don't want to give us any kind of scare like that. We have beds. We're taking care of every patient. But if this trend continues, we are going to be in a world of hurt. Plans are underway to even open up additional ICU beds in the Indiana hospitals and Deaconess Midtown, Deaconess Gateway. And I hope that you can relate to the severity of that from the standpoint of, are the nurses there, are the technicians there, are the physicians there to staff additional ICU beds? That just can't happen overnight. In Henderson, we have seen as many as 6 positive COVID patients within our hospital. Not all of them need ICU beds, but there are some that need ICU beds. And there are more patients in our community needing care, but because of their high acuity, we must send them to a higher level of care, meaning Deaconess and St. Vincent's. We do have as many as 3 patients today receiving remdesivir. This is the medication that President Trump has even received in order to help the symptoms. It doesn't cure the virus, it helps the symptoms. On Tuesday of this week, just 3 days ago, over 1,000 people were tested for the virus between all the Deaconess entities. People are congregating, they're getting asymptomatic, and what that means is they do not have symptoms, but they've been in contact with somebody who has been diagnosed as being COVID positive. So we have to be diligent about getting our testing done, and oftentimes these 1,000 people, the positivity rate, meaning the number of people positive compared to the number of people tested, has been as high as 14%. That is just unheard of. In the state of Indiana, it's more like 4%, 5%. I'm sure Clay will recognize that in the state of Kentucky, it's more like 4 to 5% also. But for Deaconess to have a 14% positivity rate, that just tells you and reinforces we are in a pandemic. As the mayor has also said, we also have a rash of patients coming from the nursing homes. They're doing their very best, but their resources are very much stretched. Not only are their residents positive, but the corollary to that is that they have a huge number of staff that are now positive also. So those nursing homes, other areas where a lot of people congregate through no fault of their own, are also a seat of infection. The other thing that has not been mentioned yet is the supply of PPE equipment, personal protective equipment. It hasn't gotten as much attention recently, but folks, we have shortages, whether it be gloves, masks, not the respirators, but all the other things related to taking care of patients in this kind of pandemic. We even have a conservation task force in place to preserve what we have left. And again, I do not want to have panic in the organizations out there that depend on us. We have the supplies. We are just trying to conserve for another surge of patients coming up. All that said, this is not doom and gloom. We have an opportunity, as the judge executive, as the mayor, as Clay have already said this morning. We have an opportunity to help our community and help ourselves. Wear a mask. Even if you are the only one wearing a mask in a congregation or in a setting, wear that mask. And if you feel uncomfortable because other people are not wearing their mask, I'll be like the others in front of me. Leave the organization, leave the supermarket, leave wherever. You don't want to take your risk of catching this disease. Practice social distancing. And if you have an important wedding to go to, or if you have an important party, ask yourself and your family members, do we really need to be there? Because that could be the difference between you getting the disease or staying alive. And again, let's not be dramatic, but this is the real reality. Wash your hands frequently, just like we always talked about in the past. And I will reiterate what the mayor has already told you. Get a flu shot. They are predicting that the symptoms of the flu this year are going to be very similar to the symptoms of COVID. A lot of coughing, fever, sneezing, all those kinds of things. But be aware that the symptoms are similar and you've got the opportunity to get a flu shot. We really do have an opportunity to get our community back to normal, but it depends on each and every one of us. I have my mask on. I took it off just to talk today, but I wear this constantly, and I want you to wear your mask constantly. It is your best protection. Because folks, if we don't get this under control, it's going to be a very long fall and winter, and there are more deaths that are going to occur. That's a simple fact. Be safe, and thank you for taking care of this community, taking care of ourselves, and listening to us this morning. Thank you.
Thank you, Linda, and thanks, Clayton. Judge, thank y'all very much for presenting this morning and stressing how important this is right now in our community. You know, we have, in addition to our nurses and doctors and all of those folks, we have a lot of first responders that we are responsible for to protect, and they have to go into some really peculiar situations from time to time. So if you have to call for an ambulance or the fire department or the police department, make sure that you're doing the best that you can do in order to help keep those people safe, because we need those people working and on the street and ready to serve our community. Again, I'll just ask our citizens to do the right thing. You know what the right thing is. Please do the right thing. In this month of October, we need to make a big turnaround, and you can help us do that. Again, the businesses, do the right thing, protect your employees, and protect your customers. And you know what that requires. Step up, do the right thing, even if it's not comfortable to do that. I think we're all going to have to do that. So again, thank you for everybody that has tuned in. We might have a question or two. Donna, have you got any questions?
Yes, we have a few questions.
Okay.
This is from Blaine Centris of 44 News. He asked, besides Red Bank, have there been any events of people gathering that has led to multiple cases of COVID-19?
Clayton?
So as a region, we've seen major outbreaks with other long-term care facilities. But as a community as a whole, we are seeing community-wide spread. So no other one single contributor to the Henderson County rate. We're seeing lots of small clusters, either social gatherings, shopping outings where people ride in the car together, weddings, golf outings, just backyard barbecues. It runs the gamut. So it's not one single thing, it's community spread, and that's what we need people to understand and realize that the decisions that they make on a day-to-day basis have an impact on what's happening in the community.
Thank you.
Thank you, Clayton. And I'll mention to you that our state regulation right now is still for a maximum of 50 people. But if you have 50 people invited to an event, you need to check with the Green River Area Health Department to make sure that you can make that event safe for those 50 people. In Evansville, Indiana, they had lifted their gatherings to several hundred people, and the mayor this morning announced that I think he is taking that down to 125 people. And so we are at 50 with state regulation, and but even with 50, you've got to be very careful. Church services, revivals, and things like that have brought about a group of cases. Others, Don?
Yes. What do you advise for high school sports taking place this weekend?
Again, Clayton, you want to touch on that? Because I don't think there's a clear answer on that, but we'll ask Clayton to.
So with high school sports, in terms of spectators, there should be tight controls in place, and school systems have already implemented those. With other recommendations, they're following the Kentucky High School Sports Association. So I don't know, unless there's something more specific they're asking about.
That was the extent of the question, but I have one that's similar, if you want to stay away.
Yes.
A participant asked, will you please address what schools will be doing if that changes due to red zone?
So in terms of red zone, that's looking at the current incident rate that's based on the prior 7-day average. There are some Kentucky Department for Public Health recommendations that go along with that. However, decisions about how schools operate are going to be made by the school board and by the school superintendent. So we've been in close contact with them. We've made our recommendations. We try to provide input for different plans and processes they put into place, but ultimately the decision lies with those bodies.
I have one more.
Okay.
So far. A commenter is wanting confidence from our local officials that eating out is safe. They say that we have employed some high standards for that, and we need our community to have that confidence.
Well, I think it's as you can easily see, if you keep up with the numbers and the people and the incidents, there's no guarantees. There's no guarantees on anything that has to do with this COVID virus. However, if you stay away from large groups, you're not involved closely with large groups, you wear your mask, you wash your hands, and you distance. If you're careful, there's no guarantees, but you're going to be less apt to get the virus. But there's no guarantees on how that we can say, that's what we're asking people to do today. We're asking people to help us ensure that we have less cases in our communities, and but there's no guarantees.
I had a couple of more.
Okay.
One that just came in from the outside, which is, Clay, would you mind to repeat how the public can report a business that they see that they are not happy with what's going on in that establishment?
Yeah, so Kentucky Safer has a website, so if you just Google KY Safer, there's a hotline that goes along with that, or they may call the local health department, whichever county. I know we're talking about Henderson County here as well, but I know that you may have people outside the area. So whatever county you're in, call your local health department. But again, I want to reemphasize, we're willing to enforce this from a health department standpoint. There's an executive order. We've been charged to do that, and we will do that. But it's going to take a more collective effort to get us all on the same page. So in addition to reporting non-compliance, speak up, be leaders in your community, and enforce this with your dollars. So if you see a business that's not complying, don't patronize them. And let the business owner know. I think most of our business owners want to do the right thing, and I'm sure they want to be aware of that and understanding how it's impacting their customers and their business.
How much is our increase in COVID cases, how many might be attributed to the lifting of all restrictions except for the mask order in neighboring Indiana?
So I think we're in a different place than we were in March and April in terms of our level of knowledge that we have about how to control COVID-19. Back in the spring, there's a lot of unknowns. So I think we can move forward without the same level of restrictions that we had if people will cooperate and if people will make smart decisions in their lives. So if you will wear your mask, you will wash your hands and watch your distance, kind of self-police this, then we would not be seeing the incident rates that we're seeing now. Quite frankly, it's the level of interaction that we're having with each other, the close interaction that we're having with each other, that's leading to the spread. So I think that I would point to that as being the root cause more than lifting of restrictions.
One more question about worship services. Worship services seem to continue to have more than 50 people gather in one spot. Is there any thoughts about regulating them to 50 people while the numbers of positive cases continue going up?
So in terms of worship services, we do have good guidelines on the Kentucky Healthy at Work website. Worship service, it's important to wear your mask when you're at a worship service. It's important that you space out at a worship service. And it's important that you not attend if you're not feeling well. If you do those things, worship service will be safe.
Okay. Thank you. Thanks for those questions. Do you have any questions?
Yeah, I want to ask, I totally lost my train of thought. Do you have any questions for me?
Yeah, so, is it true that 20% of Deaconess hospital beds are being used for COVID patients? Is that?
As I mentioned, Deaconess has had a high of about 100 patients on a single day between Deaconess Gateway and Deaconess Midtown, and that is a combination of people on medical surgical units and the ICUs, but it's between two hospitals.
Okay, gotcha. And is there anything else that you'd like to tell people as far as, is there a fear that the amount of beds that we have right now won't be enough in the future?
Again, let's not put a fear into the community, because if we abide by what we're supposed to do, we won't need all of these beds filled with positive COVID patients. We also have a lot of patients coming from the nursing homes because they are unable to care for those needy people. And again, it's a combination of everybody working together, and it's not finger pointing one group at all. This is a community coming together to say, we've got a problem, let's put our heads together, not literally, and make it work.
I think I can say add as well that Deaconess Evansville, Deaconess Henderson, Deaconess Union County, the Ascension Hospital, I think everybody's working together on this, and I think that we'll be able to care for people. But it's a matter, we don't want to have to care for that many people. So be careful and do the right thing.
Yeah, so you mentioned earlier at the beginning of this that we need to kind of take October to really look at ourselves and kind of analyze what we're doing with this to get this under control. At what point, how far away, if the current trend continues in play, if you want to jump in on this too, how far away are we from actually having to take some more serious measures to kind of curtail the spread?
Well, the judge and I were on a call with the governor just this week, and the governor is very concerned about, there were 5 red counties, and now I think there's 19 red counties. And the governor is very concerned about the entire state, but particularly about these red counties. And if we cannot get this under control, then it kind of goes out of our hands, and there's going to be a mandate from the state to do this, this, and this, and sanctions and closings and whatever. So I would rather this be in our control and locally and in our citizens and businesses' control than have to wait for the state to say, hey, shut her down there in western Kentucky, you know. So I think that's the situation that I'm hoping for, is in this month of October that we can get back in a line that we can deal with and not have to worry about state government coming in and telling us that we have to do this, this, and this. Okay? All right.
Clayton, this is specifically asked of you. What is your recommendation for the kids going back to school after fall break?
So my recommendation to the individuals going to school would be to do the things that we're telling other people. Watch your distance within school, wear a mask, wash your hands. Our school system, region-wide, have done an excellent job of preparing plans to make sure that social distancing is happening within their facilities. They're cooperating with contact tracing, taking appropriate steps when we do identify cases. So follow the rules. Do the right thing, be responsible, would be my advice for those students.
Do the right thing at home and do the right thing when you send your kids to school and demand that that those kids are safe in the classroom. Yes, sir.
And Clay, you mentioned earlier that we're seeing examples of community spread with this virus over those in this recent period. How much of that is attributed to Henderson County, or how much of that is attributed to most of the region? Or are we seeing more of the nursing home cases here in the county?
So our rates of incidents here in Henderson County and in the region have been amplified by facilities like long-term care facilities, but they're not the issue. We were seeing community-wide spread before we had the outbreak here in Henderson County. We're seeing high rates of incident across the river in the southern Indiana counties that are close by. Union, Webster County have also had high incident rates. Davis County has had very high incident rates. I think we can contribute it more to our interactions, our general attitudes, our behaviors, than to point to a certain facility or a sector, have you. Back in April, we did have businesses that were large contributors, but here recently, it's just been community-wide spread, and it's been accelerating.
And how much have you guys been working with the maybe the health departments across the river in Indiana and things like that, and government officials over there to kind of make sure that the spread is contained?
So we're in contact with our neighboring jurisdictions. Obviously we have different governmental structures, and we answer to different governing bodies. But we're all following public health. We're all following science. So the strategies there are very similar to what they are here.
Okay, with that, I think, yes, ma'am.
One more comment from Senator Robbie Mills. He asked to pass along thanks for your reasonable responses and your instructions for the community.
Thank you. Thanks, Robbie, for tuning in. We appreciate that. With that, we are going to close, and thank you again for those folks that are here, that are presenters, and they did a great job as usual, and I just knew that they would. And thanks for all of the people that connected electronically with us, and I hope everybody got something out of this, because there's a lot to take out of this, so thank you very much.
Thank you.
Thanks, Linda. Thanks, Clayton.
Ma'am.
Thanks, Judge.